Hi everyone, welcome back to the channel. Today we're diving deep into a condition that affects millions of people worldwide, Irritable Bowel Syndrome, or IBS. We're going to cover everything you need to know, from symptoms to causes to treatment options. So let's get started. So what exactly is Irritable Bowel Syndrome? IBS is a common disorder that affects the large intestine. It's a chronic condition, meaning it lasts a long time, often for years, but it's not something that damages your intestines permanently. It's important to note that while IBS can cause significant discomfort, it doesn't increase your risk of colorectal cancer. IBS is typically classified into three types based on the symptoms: IBS-C with constipation, IBS-D with diarrhea, and IBS-M, a mix of both. Let's talk about the symptoms. IBS symptoms can vary widely from person to person, but the most common include abdominal pain, cramping, bloating, gas, and changes in bowel habits, like diarrhea or constipation. Some people might also experience mucus in their stool, or feel like they haven't completely emptied their bowels after going to the bathroom. These symptoms can come and go, and they often flare up during times of stress or after eating certain foods. So what causes IBS? Well, the exact cause is still unknown, but we do know that several factors can play a role. These include issues with how the brain and gut interact, abnormalities in the gut's nervous system, inflammation in the intestines, severe infections, and changes in the gut's microflora, that's the bacteria in your gut. Stress and hormones also seem to influence IBS symptoms, which might explain why women are more commonly affected than men. Diagnosing IBS can be tricky since there's no specific test for it. Typically, doctors will diagnose IBS based on your symptoms and by ruling out other conditions. They might use the Romain-V criteria, which focuses on abdominal pain related to bowel movements and changes in stool frequency or form. Sometimes, additional tests like blood tests, stool tests, or colonoscopy might be done to rule out other conditions like celiac disease or inflammatory bowel disease. Now let's move on to treatment options. While there's no cure for IBS, there are several ways to manage the symptoms. These include dietary changes, medications, and lifestyle modifications. One of the first steps in managing IBS is identifying and avoiding trigger foods. Common triggers include dairy, gluten, caffeine, and fatty foods. A low FODMAP diet, which eliminates certain types of carbohydrates, has been shown to help many people with IBS. Medications can also play a role. Depending on your symptoms, your doctor might prescribe fiber supplements, laxatives, anti-diarrheal medications, antispasmodics, or even antidepressants, which can help with pain and other symptoms. Lifestyle changes like regular exercise, stress management techniques, and getting enough sleep are also crucial in managing IBS. Living with IBS can be challenging, but with the right management plan, many people can lead full and active lives. It's important to work closely with your healthcare provider to develop a plan that works for you. Remember, what works for one person may not work for another, so it might take some time to find the right combination of treatments. Thanks for watching. I hope this video helped you understand more about Irritable Bowel Syndrome. If you have any questions or want to share your experiences, feel free to drop a comment below. Don't forget to like, subscribe, and hit the notification bell so you never miss an update. Take care, and I'll see you in the next video.